pandemic planning at the community level. I'm asking Congress to provide $583 million for pandemic preparedness, including $100 million to help states complete and exercise their pandemic plans now before a pandemic strikes. If an influenza pandemic strikes, every nation, every state in this union, and every community in these states must be ready. To respond to a pandemic, we need medical personnel and adequate supplies of equipment. In a pandemic, everything from syringes to hospital beds, respirators, masks, and protective equipment would be in short supply. So the federal government is stockpiling critical supplies in locations across America as part of the Strategic National Stockpile. The Department of Health and Human Services is helping states create rosters of medical personnel who are willing to help alleviate local shortfalls during a pandemic. And every federal department involved in health care is expanding plans to ensure that all federal medical facilities, personnel, and response capabilities are available to support local communities in the event of a pandemic crisis. To respond to a pandemic, the American people need to have information to protect themselves and others. In a pandemic, an infection carried by one person can be transmitted to many other people, and so every American must take personal responsibility for stopping the spread of the virus. To provide Americans with more information about pandemics, we're launching a new website, pandemicflu.gov. That ought to be easy for people to remember. Pandemicflu.gov. The website will keep our citizens informed about the preparations underway, steps they can take now to prepare for a pandemic, and what every American can do to decrease their risk of contracting and spreading the disease in the event of an outbreak. To respond to a pandemic, members of the international community will continue to work together. An influenza pandemic would be an event with global consequences, and therefore we continue to need to develop a global response. We've called nations together in the past and we'll continue to call nations together to work with public health experts to better coordinate our efforts to deal with a disaster. Now, all the steps I've outlined today require immediate resources. Because a pandemic can strike at any time, we can't waste time in preparing. So to meet all our goals, I'm requesting a total of $7.1 billion in emergency funding from the United States Congress. By making critical investments today, we'll strengthen our ability to safeguard the American people in the awful event of a devastating global pandemic. And at the same time, we'll bring our nation's public health and medical infrastructure more squarely in the 21st century. Steps I've outlined will also help our nation in other critical ways. By perfecting cell-based technologies now, we will be able to produce vaccines for a range of illnesses and save countless lives. By strengthening our domestic vaccine industry, we can help ensure that our nation will never again have a shortage of vaccine for seasonal flu. And by putting in place and exercising pandemic emergency plans across the nation, we can help our nation prepare for other dangers, such as a terrorist attack using chemical or biological weapons. Leaders at every level of government have a responsibility to confront dangers before they appear and engage the American people in the best course of action. It is vital that our nation discuss and address the threat of pandemic flu now. There is no pandemic flu in our country or in the world at this time. But if we wait for a pandemic to appear, it will be too late to prepare. And one day, many lives could be needlessly lost because we failed to act today. By preparing now, we can give our citizens some peace of mind knowing that our nation is ready to act at the first sign of danger, and that we have the plans in place to prevent and, if necessary, withstand an influenza pandemic. Thank you for coming today to let me outline my strategy. Thank the United States Congress for considering this measure. May God bless you all.